Go ahead.
Sure, sounds good. I'll do my best. I do believe I have a bit more content, so I'll skip through some parts or move fast through others. But yeah, let's give it a go. Obviously, I've been here for a while now, and we've always wanted to a obviously develop very strong methods in AI and b apply them to the real world, and especially in areas like science and healthcare, and make some kind of progress there. But I thought that it's every once in a while sort of worthwhile stopping, taking a step back, and figuring out again like why we're doing all of this and trying to contextualize that a bit. So I'll open with a bit of an intro on AI for good. Then I'll give two brief examples of some of the applications we've done in in this mentioned space. I'll talk more about the beginnings than where we are at the moment. Obviously, the field is progressing very rapidly, and a lot of very exciting stuff is happening. And if there is time, I may conclude with a brief comment on some new perspectives of human-centered AI, but we'll see when we get there. Also, I do have, I think, a hard stop in 35 minutes, so I'll try to finish a bit early so there is some time for questions. Anyway, let's go. So obviously, we are doing this because we want to do some good. I think this goes without saying. But it's actually interesting to think about what we mean by good with AI or with technology in general. And it's somewhat surprising that it's actually a somewhat contentious topic. It's not so clear what is meant by that when we say we're doing good. There are actually many definitions, and different people simply mean different things, and they sometimes disagree. Sometimes they disagree on what is and isn't good. And even when it comes to topics, and this is not going to be a topic of the discussion today, like artificial general intelligence, which is again maybe on everyone's mind with these big strides that some of the new big foundation models are making. Not that they've approached that point just yet, right? But again, it's becoming more of a topic of discussion. And there are a lot of people in AI ethics that strongly oppose, for example, AGI as, and they see it as something that doesn't bring good to humanity, whereas others would say that it's one of the best things we could do as a species, right? So there are some very, very big disagreements in the space. In terms of definitions people tend to use, um, again, they vary quite a bit. It has to do whether we're building something that's beneficial for the community at large, for sort of everyone, whether it's targeted to individuals, more personalized. Is it something that we can do independently? Does the community need to actively participate? Um, is it a strict requirement, or that we can't exacerbate inequalities even if we level everything up for everyone? Because society is not equal. Sometimes what we mean by good is that we specifically empower people who are marginalized in the applications that we make happen through AI. Also, there is a conflict between addressing immediate needs, something that's a problem right now, or optimizing for more long-term future objectives, especially if there is a higher resource utilization to make something come about, right? So it's sort of worth thinking about each and every project we're doing or a piece of technology we're building and how it maps onto this space. And over the last couple of years, lots of people have convened in various places and have drafted up lots of resolutions, which is just to say that there is an active discussion on this. We'll not be talking about this today, but it's a space to watch. In terms of existing frameworks, there is obviously this very well known and used framework of Sustainable Development Goals that is used to track progress internationally on various important topics of interest. And it's a framework that we can ourselves use to contextualize some of the work that we do, as it is readily available. One angle I think that's sort of worth bringing up at this point is that we are technologists. I mean, most of us, I guess, gathered here and people working in machine learning. But the fact that we even have a desire to do good and engage with some of these spaces is not always as beneficial as we would like to believe. And there is this phenomenon of, and this is not, I mean, this is obviously an intentional misspelling, right? Where people see volunteering or working in these spaces as a sort of a kind of an excursion. I think they do once in a while, almost like for their own promotion or entertainment, if that makes sense. Um, So it doesn't really bring value to the groups, to the communities, to the fields where we come and do these things, if we engage in a way that's not humble and honest enough, I would say. And we've seen, I mean, not to maybe go through the list, but we've seen, I guess, examples of that with COVID, something that we've all been through. And I mean, I still remember back then, in my Twitter feed, every day there would be some announcement of some new machine learning model for either predicting COVID or detecting it from, audio recordings of people coughing, or something that has to do with, again, lung scans, or perhaps electronic health records. Doesn't really matter. There were lots and lots and lots of papers being pumped out. And it turns out that not all, maybe all is an overstatement, but the vast majority of the content being created then by technologists, machine learning in healthcare for COVID, has been a major distraction. It has distracted people who were trying to follow, hoping to find something, who should have spent maybe their time doing something else. It has diverted resources that could have gone to helping in other ways. And yeah, it has garnered citations for people involved, right? But it hasn't actually helped. So that's a counter example. That's an example of how not to do AI for good. And it's sort of ironic, because it was one of the most pressing, biggest issues we faced as humanity. And still, we as a machine learning community hadn't organized in the right way to help, really help correctly. And yeah, more and more people are waking up to that. And obviously, there were lots of comments back in the day. And this is somewhat related, though maybe different, to the digital savior complex, which sees technology as the primary way of addressing problems. And then technological progress is seen as the main way of making progress. And we just can't wait to utilize a new flashy piece of technology to, try to help address some big societal issue. Then again, oftentimes this doesn't translate to better lives. And we don't ask the question often enough, like, if we're building something, who controls it? How is it likely to be used? Not how do we personally, as researchers, wish for it to be used, but we are bringing about this technology in an existing society with existing structures. So some people will benefit more, some people will benefit less, some people will steer the use of technology in certain ways. And producing technology is not value neutral. Obviously, it enters this existing framework. So it's something that we, again, need to be actively thinking about if we want to genuinely be doing good. So clearly, our mission is and should be to responsibly develop AI to genuinely benefit humanity. Um, as per the previous section, the question arises as to how to do this exactly, but that should obviously be our objective. And if you think about various applications in this space, I mean, it's a very inspiring time to be doing this. There are lots of great things that people out there are doing, and these are not our projects, right? This is a mix of what various groups are up to, whether it's translating animal communication, whether it's applications in sustainability and climate, whether it's education. There are obviously very many important areas. And it's very pressing that we do this, because the world, I mean, maybe it's always been in a crisis of sorts, depending on how you want to look at it, but we are facing multiple deep crises. I mean, obviously, climate change is a big one. Biodiversity loss uh, is a major one. Like, as the first point says, like 70% of all wildlife has been lost in the last 50 years. That's huge, right? So we should do something about this. Obviously, technology may have been, or rather, the resources needed for the development of technology may have been a part of the reason even why this happened in the first place. But clearly, there are solutions that are needed. There are many solutions that are needed, not a single one. Same goes for microplastics, which has obviously permeated everything, and it just keeps being identified more and more in higher concentrations in human tissues with various adverse health effects. There is still lots of poverty, various deep issues. So we need to do something about this. And when it comes to sustainable development goals, which were, I guess, on the slide before, they do give us a framework for that. But it's also worth noting that even if they are an existing quite specific set of not just high level goals, they have sub goals that are being tracked, that countries commit to, etc. We're still failing to meet them. So they give us a framework, but there is a bit of a crisis again in terms of them not being achieved, them not being met for various reasons. And especially in less developed part of the world, they are just not being met to a large extent. Just to visualize this on a plot, it feels a bit half, right? So we are behind on the goals that we've set for ourselves, and this is obviously not good. So we then need to ask ourselves, what can we do to help drive this forward, and to avoid these types of really bad outcomes, because we don't want to be in a world where people are still hungry and poor, not covered by healthcare, and these are just very pressing issues. Now, this may not be what a lot of the scientific research is directly addressing. Um, and obviously, science is very big. There are many fields, there are many papers that come out every day. But it stands to reason that the complexity of the issues we're facing does require not only political action and coordination, which clearly does, but it does require some amount of well posed, well coordinated technological and scientific progress as well. And if you think about all of those resolutions that were brought up before that people have put together, one thing that keeps popping up within them is science and scientific progress. And yeah, there is obviously an opportunity to aim AI specifically to help drive forward innovation in science, with the hope that some of those will then translate and make some of these things better in the near or longer term future. So let's talk a little bit about that. And I think it's actually quite humbling being here, because I would say that DeepMind has been one of those places where a lot of AI for science has happened, a lot of innovation over the years, whether it's in biotech with obviously AlphaFold and similar types of innovations there, whether it's people looking into physics and fusion and mathematics, or whether there is just a vast variety of applications, and it's something we value quite deeply, I would say, as an organization. But I will not be diving into all of those. Obviously, there is a large number of very big projects that have been done here. I just again like take a step back and talk a bit about how we see this, how we contextualize this, and this is obviously a gross oversimplification of what science is. But roughly speaking, we can see the production of new knowledge as being on a sort of a tree where some insights are closer to the roots, they're more fundamental, and some insights here, I guess, depicted more as leaves, are more applied. And then in terms of AI, right, because otherwise this slide would make no sense. Uh, Clearly, what we do here maps onto how we make impact with AI for good, let's say, because innovation in the fundamental space may not have an immediate impact, but the hope is that it would later unlock things that will make applications run better. And arguably, some of the biggest advances in AI for good could potentially be made in the fundamental part of the space. It just may take longer for them to be utilized, and obviously they're a bit detached from applications as it stands. However, we can also choose to directly work on more applied areas like healthcare, and I will talk a little bit about our work in healthcare later on. And there, our impact is going to be more immediate, more short term, if that makes sense. Also, over the long term, it's clear to define problems in that space and use cases and so on. And I think the right thing to do, obviously, is to do a bit of both. But it's just to say that even in areas like for mathematics, obviously, we're not solving directly any of the problems mentioned before, but it's an area we're invested in for the reason mentioned just now, where both maths and physics certainly have a role to play, even if it's a bit of a longer game. And there have been clearly large advances in AI formats recently. I'm not going to talk about them. I'm going to talk about one of the very first pieces of work we've done there that has shown to people that there is space for machine learning in mathematics to help drive results forward. And it was fairly simple methodologically. So this is not going to be, I guess, super interesting from a methodological point of view, but that's sort of the point that I'm trying to make, which is that one can make good progress without necessarily something that's methodologically very heavy, and that there is an opportunity for obviously far more than that. So the system we built then, this was a couple of years ago in that paper, this was in collaboration with a couple of great mathematicians here from Oxford, um, was simply to use machine learning to help come up with new hypotheses that would then, as mathematical conjectures, potentially be proven or disproven, and there will be a kind of a loop, interacting obviously with the experts, not an autonomous system, um, rather seeing if machine learning can be a good set of tools for mathematicians to use to help gain new insights. And we've looked at, well, there were some other applications as well, I think, in representation theory, but the work stream there that I was involved with was looking at knot theory. And for those that don't know, I mean, knots are, again, embeddings of topological spaces in topological spaces more broadly, but more specifically, I guess, here circles in 3D Euclidean space. And they can be seen as either geometric or, I guess, algebraic objects. And a lot of progress in knot theory has been made also from the algebraic side. Each knot can be represented via many possible diagrams, and figuring out which diagram maps onto which knot and which are equivalent there, problems. So it's not always straightforward to tell. And there are lots of invariants that have been developed to characterize different knots and types of knots and help check for knot equivalence also. Um, so we've looked at those. And in particular, because I said there are two ways, I guess, roughly speaking, of looking at and interpreting knots. There are also some of these invariants and quantities that have being computed from these two perspectives. So they have a geometric interpretation or an algebraic interpretation. And at the time, not very many connections were known between the two. So what we've done was actually a fairly simple thing, which is looking at the data set, and there were some data sets available at the time. We've looked at a couple of them. We also constructed some synthetic data sets ourselves for some special classes of knots. We've computed their invariants. Some of these invariants are scalars, some are polynomials. It's a mix of things. And then what we would do is we would have one invariant as a target and the rest as the input features. I guess there were not so very many, so we could do this and repeat this a couple of times and just fit a neural network in between. This was just an MLP. It was nothing fancy. And then basically look at feature saliency, look at which invariants play a role in the model that predicts the others, to try to find if there is some sort of a computational connection. So for signature, we did find that, and not signature is one of these invariants I was talking about, it's an algebraic one. We've effectively identified some features in the data that were highly predictive, did some data analysis that helped us gain an intuition on that. And when I say we, I mostly mean, obviously, mathematicians that we worked with. Come up with an initial conjecture, show that it's not true. We've found cases where it doesn't work, refine it, repeat the process, do some more work, and basically come up with something that is a mathematical conjecture. And if you think about this, this was fairly trivial from the machine learning point of view, but it still led to a novel mathematical result. So yeah, that's, I would say, not a bad thing if you can do things simply. And in the context of this whole talk, again, knot theory is a theoretical field, it's a mathematical field, but it does have lots of applications in studying things in both biology and physics and so on, and various links. Just to mention briefly, obviously the bigger advances that we've seen recently had to do with applications that really drove forward the understanding in geometry, using fun search, also the Maths Olympiads that just happened recently. But moving along, in terms of more applied things that we've done, I think healthcare has been one of those main areas. And when I first joined DeepMind, which was now, I guess, close to 9 years ago, this is the team that I joined back then. We were obviously at the time fairly small, and at that point in time, deep learning was yet to make any kind of an impact in that space. So we were, I think, the first or one of the very first groups that has made it happen, and that was really nice to see, to be a part of that. Nowadays, I think there are so many people working with deep learning in healthcare. It's very clear that it's it's bringing benefits, but yeah, I think it wasn't so clear to so many people back then. These were some of the early papers we've done. I'll talk briefly about one of them, and I would just say that many things are obvious in hindsight. So it's probably going to seem fairly obvious that this would have worked, but at the time, people were not convinced that neural networks had anything to bring. So when it comes to working with electronic health records, people were still using things like logistic regression and so on pre-computed features, thinking that having nicely clean, clinically designed features there would simply be best. And we've shown that this was just not true. So the problem we've tried to tackle was the problem of acute kidney injury, which affects lots of people, leads to lots of deaths, and has a very high cost. It's very prominent, not just here, but also everywhere. And it's a very big problem for hospitalized patients. We've had clinicians on our team, so we're working very closely with clinical experts in this space. And this was one of the key reasons why we were, I think, capable of doing good things. Another problem that existed back then was, I mean, it still exists because these technologies are not so widely implemented yet, is that there is normally a delay in recognition. The delay is not only, obviously, it's partly because people don't get tested for these types of things all the time, but even when measurements are taken, so bloods are taken and the numbers come in, the problem is that the criterion that exists, so it measures, it comes off of serum creatinine. Like, mostly there are some other factors in the formula depending on how you pose it, but serum creatinine raises in the blood to the levels that would trigger an alert for acute kidney injury only after the injury has already occurred, something like 48 hours after, actually. So even when it gets caught, it's already late, and whatever is causing the problem has been causing it for 2 extra days, causing extra damage. So there was a pressing need to have an early alerting system to help address this. And unsurprisingly, these hospital pathways are very complicated, and we wanted to make a solution that is going to cut through this and alert quicker, get patients the right care quicker, and improve outcomes. So we had this collaboration with the U.S. Department of Veterans Affairs. They've given us this big pseudonymized data set where, yeah, we've had all sorts of things about what was happening at the hospital in terms of bloods, tests, prescriptions, procedures being performed, etc. And yeah, this is sort of what I mentioned, so I'm not going to repeat myself. And what we did is we approached this as a sort of a sequential prediction task with recurrent neural networks back then. I guess nowadays you could also do this in some other way with transformers and so on. And the model would consume this in discrete buckets and make a prediction. And at each point, it would make a prediction of a risk of AKI kind of occurring in the next, well, across multiple horizons in the near future, to sort of try to catch this early. There were lots of details to the model itself that I guess are not relevant for the purpose of this talk. Let's just say that the very naive application of this didn't work well enough at all, and that we had to do a lot of tuning on the model to get it to the level where the number of false positive alerts that it would raise would not be overwhelming, and it would have a high enough accuracy. So it was a hard problem. It was not an easy problem, at least back then. And the ground truth was noisy and the data was noisy, so these things didn't help. But we did develop a model. It was a sort of a, yeah, slightly deeper RNN with some highway connections and multitask learning and things like that. But again, it doesn't really matter. The point is, we managed to show that we can produce a model at a level of performance that you could see, with various caveats, because these things need to always go through clinical trials and be made robust, etc. But that you could see being at the hospital potentially, just based on the numbers from the retrospective study. And that was really exciting. So we could get, over 50% of AKI of any level, with a sort of a ratio that would still obviously be raising false positives. According to the definition we've had, we've actually looked into the data, and lots of those were actually correct predictions. They were just counted as false positives. But then if you were to look at the sensitivity for severe cases, it was actually far, far higher. So that was quite nice. This is just an example of some predictions and some cases. Well, cases. Obviously, not the entirety of the data. This was like 600,000 dimensions, but just showing the serum creatinine above, and some of the predictions for other vitals, and predictions for the risk. And yeah, this was what we've done back then. And the field has shifted a bit since. Obviously, there were lots of specific models that both we've developed and that got developed in the meantime. But I think there is a major shift happening at the moment, where we're moving from, which is not to say that these are not valuable or still being developed, but we're moving away from the emphasis on the development of specialized machine learning models in healthcare, to maybe more of an emphasis on developing multimodal foundation models that can handle multiple things. And these multimodal models can potentially even call specialized models as tools. Tool use with language models is quite popular nowadays as a research topic, right? So you can augment the foundation models in that way. And the reason why this shift is happening is that human health is just so complex, that very many bits and pieces of information need to be integrated, factored in when making decisions. And these types of systems excel at being this kind of language and a layer that can connect and consume very, very diverse modalities and information across, and help make some kind of a prediction. They're also more interactive. And we've shown that some of the foundation models developed here have really good capabilities, both in terms of just the medical knowledge they encode, which is normally tested through these popular question answering benchmarks when it comes to language models, also in terms of understanding in some other multimodal areas, and so on. Unsurprising, there is actually, it's probably worth a comment. Ignoring what the individual points are, or what are our models or someone else's models, but we are currently, obviously, this is a bit of an older plot, but we're currently in October 24, right? In March 22, which is not that long ago, these things just didn't work, right? And there is this huge, huge jump in performance that happened just over the course of the last 2 years, with mostly, not exclusively, obviously, there have been various improvements methodologically, but through scale to a large extent. And I couldn't dial in earlier for the previous talk. I saw there were some questions on scale. This is one demonstration of what scale can give you. And it's not the only thing that matters by any means, but it can give you a lot, for sure. And again, some of these newer systems, they also involve using external sources, using search, having reasoning traces, looking across those reasoning traces, picking the best ones, having assessments of uncertainty, and only calling external sources when they are uncertain how to proceed, etc., etc. Long context, multimodal understanding. So there are lots of components to the systems. They're not just sort of naively producing the next token. And because they're becoming so sophisticated and so advanced, we can actually do various really interesting things with them. And rather than just answering questions, there was a system we developed recently, which is called AMI, which is short for Articulate Medical Intelligence Explorer. Maybe not the best acronym in the world, but the good acronyms get taken quickly. Anyway, it's a system that's been made for interactive conversational diagnostic dialogue. So you would communicate with the system as you do with your doctor, with your general practitioner, and this system would ask you questions. It will also answer your queries if you have any. And at the end of the dialogue, and it decides when the time is to end it, it would produce some kind of a differential diagnosis and maybe a recommendation for follow-up tests and things like that. The system itself has been trained through sort of self-play. I mean, obviously, this sort of data is very sensitive, so it doesn't really involve any sensitive data whatsoever. Rather, what it does instead is there are some scenario packs that are being generated, and then the system itself pretends to be a patient. And it also pretends to be a doctor. Just they're differently prompted versions of the same system, and they interact. There is a kind of a critic in the end and filtering, and then there is a bit of a self-improvement loop going on to improve the system and get it to the point where it performs well. And yeah, I don't think I have the results here on the slide, but basically, this system was evaluated across very many axes of performance, and I think it was 32 off the top of my head, and I think it outperformed human clinicians on 28 and drew on 4, again from memory, but it was something like that in any case. So it was a very powerful system, and obviously this is not yet being used. This is just a prototype, and there are many questions that can be raised about how this was evaluated, because again, until something is actually evaluated very, very carefully prospectively, the clinic, one never knows. But it just goes to show the promise there is in this space, where there is such a big issue in the UK here especially, but I guess everywhere when it comes to access to high quality healthcare. And we already seemingly have the technology that could, over the years to come, transform that in a very, very deep, fundamental way. Um, I would just say that maybe as a final point, and I'm going to leave the next 5 minutes for questions, and I'll go into the remaining slides, is that we're also doing a lot of work here on AI ethics. And in particular, as we've sort of seen here, we are moving into an era where rather than just talking about individual machine learning models, we are really talking about the development of advanced, powerful AI assistants and agents that can do very many things for us. And what we end up doing with them and how we decide to use them as a society may be a different question, but they simply have a large set of skills and capabilities, and this requires us to think about how we're making impact in a different way, and to be ever more careful about simply contextualizing things and understanding how this technology is going to be used. So I'm going to pretty much stop there. There are obviously bespoke opportunities here, but yeah, if there are any questions, I guess we have the next 5 minutes, so I should probably be a good point to stop. I have no sound here from the room, unlike in the beginning, so not sure why that is.
Testing?
Yes, now it's good.
Oh, good, good. Thank you for the presentation. Regarding the sort of ethical use of AI or machine learning, in terms of environmental impact, because ultimately these, especially large language models, are very, very energy intensive, as well as being very resource intensive in terms of just having all of these, this hardware and such. So at what point do you think it is ultimately environmentally responsible to use AI or machine learning models to solve issues that could be ultimately solved with a simpler approach?
I mean, that's a very good question. It's one of the considerations that obviously matters a lot in terms of the cost-benefit analysis, right? I do think, you obviously have a point. There is currently a very big push towards these big models. They have, because they're big, a bigger footprint than smaller models, right? And this could be beneficial or not if you could sum overall the positive impact. You could subtract all of the negative impact and see if you're in the positive. It seems to be very hard to do that just because there is so much positive potential. And especially if you're developing a foundational model, let's say, and you're letting others use it, you can't actually yourself very easily quantify all of the positive impact because you're not the one driving it. And also, some of these things are incomparable. Like, let's say you can save X lives, human lives, and there is a certain carbon footprint associated. Is it a meaningful question to ask, is this carbon footprint worth X lives? They're very different things, right? So it's not so easy to say. I would say one thing though, which is, and I'm by no means an expert on the topic. I've not worked in this space, but I saw various discussions online where it's been suggested that the carbon footprint actually of training large language models has been overestimated quite a bit by actually orders of magnitude, not just by a small factor. Um, for various reasons as to how these early estimates were made, and they keep being repeated. I don't personally know exactly how intensive it is, but I would say that it may not be as bad as we think. It's obviously not cheap, but it's only the training of the model once that's expensive, both financially and in terms of compute. But once you have it, inference time, again, not so much, right? So then it becomes like, if you train it once and you use it for a long time, obviously we're still iterating, so we're not at some kind of a final model. But if you train it once and use it for a long time over very many applications, it stands to reason it could be very beneficial. But at the end of the day, if you don't make a positive impact in those applications, then it's not so. Yes, it's a very important question.
Thank you.
One more question.
Yeah, thank you again for that excellent talk. And this is going to be a question kind of related to the previous question in the first part of your talk. There's a lot of concern about societal impacts of AI, and is there a way to guide that development better to make sure that it's beneficial to society? I am actually I have a somewhat contrarian thinking about this, and a concern in the other direction. You talk about the complex of digital saviors, and I worry about the complex of expert saviors, where folks like us in the academic community, especially, but also in some larger companies, may feel that we know what's better for society than the society itself, and should somehow guide it to some proper outcome. And my concern there is that we've actually had that happen multiple times in human history, never ended well. We've had 1,000-year-long dark ages where the priesthood, in effect, held development back because they thought they knew better. I'm concerned with something similar possibly being tried to be pushed on, say, AI development, and by trying to make it more responsible, we actually make the opposite effect, where we hold back development and therefore, slow down the human race in some sense. What are your thoughts about this? How do we balance these two, let's say, risks?
I mean, it's a very complex topic, so it's very hard to give a very short answer on it. I would say, though, that in terms of having some degree of um, regulation and responsibility in how things are approached, if you look at like genetics, for example, and maybe some other areas in science, frameworks already exist there. So it's not like science is completely unregulated. Therefore, it stands to reason that it should be possible. And regulation is obviously just one part of the spectrum, but it stands to reason that it should be possible to have a responsible AI development framework that doesn't really slow things down to the extent that it would slash the benefits as well. In terms of experts versus the rest of society, I mean, I fully agree that we should all be doing more, and we have some projects here down those lines, more participatory engagement with the communities to involve them, solicit opinions, not just think that we have the answers to all the questions. Obviously, that's not super easy to do meaningfully either. So there is a complementary piece of work that needs to be done further on education on AI as well. I think many people will not really know so much. or think that AI is ChatGPT right nowadays, if that's what they know. So if we want to engage them and to get meaningful feedback from them, we also need to educate them and make sure they understand more in the conversation that they're engaging in. But yes, I mean, we obviously need to do that.
Okay, I have two questions. Just prefacing it, I'm an astrophysicist, so probably very naive ones. One was this that you were showing, I think it was Mad Gemini, the improvement in diagnostics, right? With this huge development around ChatGPT time and things like that. But then sort of, right, October point was not there, but there seemed to be some plateauing. Is it, I forgot what was on the y-axis. Did you already reach precision that you want, or this plateauing, is it due to data, the architectures and things like that? Yeah, thanks.
I mean, the numbers were close to 100, so they have to plateau at some point, right? Because they can't go over
Okay, that's
100.
what I forgot.
They were not at 100 though, and we did look at the data, and effectively, as with any such human data, there is some level of intrinsic ambiguity. So it feels like 100% is unrealistic unless you're overfitting on the data set. It's like 90 something percent that would be the maximum you'd ever hope to achieve, which basically means that that particular benchmark has been saturated. And this is something that has been happening more and more when it comes to foundation models, that obviously people are building more benchmarks, but the benchmarks that we used to have, they are just being saturated. The models are just solving them entirely. So we constantly need to be developing new and harder benchmarks to have a way of measuring progress, because yeah, once you hit those high 90s, it's not super meaningful to look at the benchmark anymore.
Sure, cool. And then for Amy, I wanted to understand better. So this is a tool where it's like talking to a doctor in a sense. He doesn't analyze the data, lab data. You just say your symptoms, I guess. That's the point there. And so the question would be, going on in the future, so you did not release it yet, but when released, how you, again, touching on an ethics, you always expect anyway to be a doctor in the loop, whose responsibility it will be, and things like that. So what are the thoughts? I guess you don't have answers, but yeah.
I guess you're completely right. Those are all the things that need to be figured out. And there is a lot of exciting work to be done there, because it's not super obvious what the best way of doing things is. Like, yes, from one point of view, you would obviously intuitively want to always have a human expert in the loop when it comes to sensitive applications like this. This is how it's traditionally been done when it comes to new technology being rolled out, for a very good reason. At the same time, there are mixed results in literature, and I find that personally interesting, somewhat fascinating, somewhat scared as well of the implications there. But if you look at the literature of using AI in medicine, in some other fields, not for diagnostic dialogue, but let's say in radiology, right? And there have been lots of people that have published on machine learning or computer vision in radiology. But some studies have tried combining the use of these systems with human doctors, so not replacing them, but giving people access to those models and model predictions. And then the hope is in this sort of, I guess, centaur is how one would frame it traditionally in AI, that human plus AI is going to be better than either human or AI, right? You would want to get this sort of positive synergy, and you would also have a situation where these human experts would catch errors that the system makes, because the system may sometimes make silly errors, or it's still for adversarial types of reasons or out of distribution reasons or who knows what. However, it turns out that oftentimes this performs worse than AI on its own, even though you also have a human expert in the loop. And this is for various reasons. One of the, I think, common psychological reasons is that human experts override AI decisions when AI is right and they are wrong, because they have an ego. And they also don't trust the technology. So it's not super easy to reach this positive situation that we're striving towards, where we improve the deployment of the system by having a human in the loop. Sometimes it can be worse to have a human in the loop. Sometimes it can also be worse to have any AI at all. But the synergy between the two is not super easy to engineer, and it needs to be done very, very carefully. Obviously, there are also human-computer interaction types of research, UX research that needs to be done on how to make this work well. But all that I'm trying to say, it's not an easy problem at all.
I see. Okay, good. Fascinating. This should probably be, yeah, developed more. Just one more question from the audience.
Hi, thank you for the presentation. I have a practical question. So which free LLM would you recommend for researcher working with electronic health records? And also maybe another question for multimodal learning. Where to start?
I mean, that's a very good question. I'm not, funnily enough, I don't think I'm the best person to answer it, just because we have our own models that we're developing here, obviously. So that's what we use when we do work, which consequently means I don't actually use any of these open models to do this kind of research. So I wouldn't know which one works best right now, but just from what I can see from all the updates I get, which I still sort of follow on Twitter, is that the answer would also change almost like every week, just because there is so much progress in this space. But I think it will largely depend on what it is you want to do with it, because if you care about clinical notes, so free text first and foremost, then you just want a model that's strong in language. If you really want to, if you care not to drop any tiny piece of information, so you want models that are very good at those like needle in the haystack kinds of tests that even if you put like a lot of content in the context, they will utilize all of it. They will not like drop bits and pieces because they're not allocating their attention well, right? Maybe it's multimodality that you want primarily. Maybe that's maybe again a different answer. So yeah, when it comes to these free models, just think about what the main thing you want to do is, and then look at that particular capability, and it should be in the reports when they're released, to compare how good they are on that dimension. But otherwise, I have no experience with them to share, so nothing more I can say.
Okay, perfect. Thank you, Nenad, very much.
Thanks, everyone.